Treatments for osteoporosis, there's actually been a lot of progress the last few years. There's actually some very, very good medicines available to us now. We've got anabolic agents, which actually help to grow bone. Those are typically injectables for a year or 2 years of injections. Some of those are injections monthly. There's also some injections that are just every 6 months, like twice a year. And those can actually help to grow bone and increase your bone mass, so that the DEXA study might show increased bone mass. I think there's other medicines that are anti-resorptives. They kind of limit your body's ability to take away your bone. Some people that the balance between bone formation and bone absorption is really tilted towards excessive bone absorption. And so that really is taking away more bone than it should. And so we can slow down that process of bone absorption by using some of these medicines. And they're very safe overall. I think that there are always some side effects to all medicines. Some of the side effects that are touted, which are very, very rare, but there's osteonecrosis of the jaw that's a concern. You want to make sure that your dental health is good. You have good dental hygiene. You visit the dentist frequently, and that's a very small risk. And atypical femur fractures is another potential risk, but some of those risks can be mitigated by some holidays of your treatment. Let's say you're on an oral bisphosphonate, which is an anti-resorptive agent. If you take that for 5 years, sometimes we then can stop your treatment for another number of years before we start that back up again, and that can minimize the potential downsides to those medications. But by and far, patients benefit tremendously from these medications, and the risks that are associated with them are such a small concern compared to all of the fractures and disability that osteoporosis can cause.